Hello, I'm Jeremy Fernandez. This latest wave of the pandemic is striking India with unprecedented brutality. The numbers of COVID-19 infections and deaths are growing with alarming speed. Data analyst Casey Briggs is with us for a look at the extent of the problem. Casey.
Jeremy, well, daily infections in India have been now climbing for 12 weeks straight. And what we've seen in the past week is 3 days where cases have climbed above 400,000, record numbers being seen. And that is a trend that we're just continuing to see increase. Remembering, these are just the cases we know about. In reality, the virus is far more widespread than this. If we look at the 7-day average, that is to smooth out that daily variability from day to day and look at the underlying trend, we can see the trend line, 390,000 cases a day on average, and it is continuing to increase. But it does look like it could be starting to slow down. The big question is India now at an inflection point in their current wave of this curve? The experts differ in opinion about how quickly this peak will come. It could be weeks away according to some models. Some other models have the peak being reached imminently in the coming days. But one thing is for sure, we won't just be watching this curve to know when India has seen the back of the worst of these infections, again, the ones we know about. We'll also be watching the testing rates and the test positivity rate in India. The share of all tests that came back positive in the country has been shooting up since February, and now currently more than 20% of all tests that are done are positive for COVID-19. The positive sign, that hasn't been increasing for a few days. That's a few days, not a long-term trend, but it is at least a beginning. It's something that we do like to see. Vaccination rates in India, they're not going particularly quickly either. It's not vaccines that are going to get India through this current wave of catastrophe. Roughly 2.2% of the Indian population has been fully vaccinated. To put that into Australia's context, that's about roughly a week and a half ahead of where Australia's vaccine rollout is. But even then, even when this curve does peak and numbers start to come down, that is not the end. We're going to see a lot more deaths with hospitals under stress, a lot of virus unaccounted for. It's a very long time before India comes back to manageable levels of this virus.
Casey Briggs, thank you. Well, the Indian government has finally delivered the amount of oxygen that hospitals in Delhi have been demanding to treat patients. However, the virus is now spreading in rural areas where hospitals have far fewer resources.
In less than an hour, we saw 13 funerals here. The government says there were just 7 in the whole day. And this is Prime Minister Modi's own constituency. The human cost is being suppressed. This is the reality all over India. We'll never know how many died of the virus in this country. India's hinterland is where most of its people live. Amidst lockdowns in big cities, masses are returning to their homes in small towns and villages. The virus is spreading. Rundown hospitals trying to cope with a crisis they've never been equipped for. Conditions the government doesn't want people to see, so we filmed secretly. COVID patients being treated amidst people with other illnesses. The sick being cared for by their own families for a lack of doctors. This is the intensive care unit. We saw toilets overflowing on its floor. Just outside, we met Pankaj Maurya. If she'd got the right medicines and treatment, she might have survived, but she didn't get it here. His wife Rekha was 35. This is the rural health centre she was first taken to, the only one for villages around. Here they didn't discover Rekha had COVID until she became severely ill. There were no resources to treat her.
I've asked each person standing in this queue what they're suffering from. Most of them have told me it's a fever or a cough, and they're waiting in line at a primary health centre. This is the first place that someone from a village would come to. They're waiting here for the doctor who's inside to tell them what's wrong with them.
Most of these people weren't tested for COVID, and haven't had the vaccine. We drove miles to reach Rekha's village. Even getting to basic healthcare is out of reach for most here. Her husband Pankaj says their whole family had COVID symptoms. Rekha was the mother of 2 children. People here are angry. The Prime Minister makes announcements on television, but nothing reaches us, a neighbour says. Bimla Devi says there's little we can do. Those who are lucky will survive. Whoever has to die will die.
Let's go now to India correspondent James Oaten in the capital. James, how great is the backlash against Narendra Modi right now?
Well, across India, there's certainly been a great breaking of trust between the people and government here, because people here are fending for themselves. When you can't get into hospital to get treatment, people are going outside the system to source their own oxygen tanks, for instance. You know, certainly the Modi government is feeling a lot more heat now. You know, last year the government was kind of widely, praised for its handling. It took the virus very seriously. And when mistakes were made, and there were mistakes, and the virus did hit hard, people last year were, I guess, a lot more forgiving, because every country, or most countries, were going through a tough time. The anger stems this year from the fact that so much wasn't done early, and now all these kind of premature celebrations that India had conquered the virus and that it was now vaccinating the world, these calls have come back to bite it, and bite it hard. And so you do have this fueling anger towards the government. How much that will kind of impact the Prime Minister Narendra Modi and the BJP party, it's probably still too early to say at the moment. But really, and that's because we're in just a struggle for survival. We had an election just in West Bengal, and the BJP fought hard to get that seat. It put everything into winning that state election, and it didn't win. So there are people who will be reading into that election result and saying that is proof that the Prime Minister's popularity is slipping. Others obviously will disagree with that. We're still right in the thick of this crisis.
James Oaten reporting from Delhi. Well, from the start of the outbreak, the Indian Red Cross Society has been on the front line. More than 46,000 Red Cross staff and volunteers in India are supporting the COVID-19 response efforts. The head of the Red Cross South Asian delegation, Udaya Regmi, is stuck in Kathmandu and joins us now. Udaya Regmi, thank you very much for joining us. I know you're trying to get back into India, and there is a porous border between India and Nepal, so people in Kathmandu and all across that country are alarmed at the situation as it develops in India, aren't they?
Yes, there are many people got stuck who travel from India or from other parts of the world. Now is the lockdown in Kathmandu, imposed by the government of Nepal, but there are few flights, so the rescue flights is operating. Probably yesterday was the last flight depart Kathmandu. So the large number of people who wanted to go back to their duty stations, to their second home, has got stuck in Kathmandu.
We're seeing up to 47% of test results coming back positive for COVID-19. Give us a sense of what it's like on the front line in Kathmandu right now.
See, the situation here is, if you look into the trajectory comparing with India, it is little less than the Indian trajectory. But the hospitals are full and the health systems is overstretched to bring the point in many areas of the country, particularly in the southern areas bordering to India. Large number of migrant people working in India trying to cross the border. So so there are many of those peoples are really overwhelmed, and the hospital systems and health systems is extremely overstressed.
And what about the availability of vaccines? Are people getting vaccinated right now?
The vaccinations, because of the lockdown, the vaccination hold from Wednesday last week. Probably they will open the vaccination soon. There are shortage of vaccinations as well because we are getting vaccination support from India, and now vaccine from China arrived that is already administered. For the time being, because of the situation here, lockdown imposed, so the vaccination is not going on.
Do you think Nepal is dependent on help from the outside world right now, other countries, given the scale of the disaster there?
Definitely, from the donation from the other country is started coming in, especially oxygen is also going to the alarming shortage stage, and then the other facilities like the ventilators, oxygen concentrators need to intensify the hospital beds. That is government of Nepal already seeking support from the other country slowly, but the supports are started arriving to Nepal, including the International Federation of Red Cross with our National Red Cross. We are also working on to provide the support how much possible.
Uday Regmi, thank you very much for joining us.
Thank you so much, Jeremy. Bye for now.
Well, joining us now is the infectious diseases specialist from Sydney University, Professor Robert Bui, and he's a professor there at Sydney Uni. Professor, India is one of the biggest manufacturers of vaccines in the world. What is this crisis in India doing to the supply of vaccines elsewhere?
Well, India has both the Serum Institute of India, and it also has Bharat Biotech, two huge manufacturers, and they were, especially the Serum Institute, producing millions for other countries in the third world until only a couple of months ago, when they realized they were in big trouble themselves and they needed to protect their own supply before they exported. So after exporting tens of millions of doses, they then have cut off supply to the rest of the world. And the COVAX agreement, where lots of companies around the world give cheap or free vaccine, needs to be put into much better process in order to protect African countries and lower and middle income countries in Asia as well.
So which countries are the most vulnerable?
Well, there are literally tens of millions of people in both Africa and South Asia who are suffering, who are getting infected, or who will get infected quite soon. So this is far from over. The pandemic is increasing rapidly. India might be leading the way right now, but Nepal's following soon after, and many other countries in Africa will soon be rising. They might have been low for a while, but they're on the way up.
We see in Australia vaccine hesitancy to a degree in the community about people not being quite certain about which vaccine they'll get, which vaccine to choose sometimes. What is the complexion of that choice in those more vulnerable countries where vaccines are in such low supply? Do you see the same rates of hesitancy?
Most parts of the world will not have a choice as to which vaccine they take. Even in Australia, if you're over 50, there's only one option. But in poorer countries, lower and middle income, they will have very little option. They'll have to take what they're offered. But I have to say, as a vaccinologist of 30 years standing, I'll have that vaccine that's available, because I think the evidence right now for safety and protection against serious disease is very strong.
How much hope do you see on the horizon for those vulnerable countries?
Well, there's hope, but by goodness, we have to do more for them. We're so selfish in the first world. We're looking after ourselves. The US is worried about its intellectual property, and it's finally said, oh, we'll waive that. Actually, that might be just a secret way of slowing things down anyway. Europe is looking after its own. The European Commission is saying, oh, let's ensure that we get each of our countries properly supplied. And yet the death and the disasters are happening in countries where you can't even get oxygen, where you can't even get admitted to hospital. And so we really need to pay much better attention to lower and middle income countries. And they're in Asia, they're in Africa especially.
Professor Robert Bui, thank you for joining us.
A pleasure.
And that is the program for this week. Thanks for your company from all of us on the team. Bye for now.